Hello, everybody, and welcome to episode 324 of the Recovery After Stroke podcast. Today, I'm excited to bring you the inspiring story of Norman Vandal, a stroke survivor of a basilar artery stroke. In this episode, Norman shares his journey from the initial symptoms of his stroke through the challenges of rehabilitation and his determination to regain independence. He talks candidly about the emotional ups and downs of recovery, his time in stroke rehabilitation boot camp, and the lessons he learned along the way. Norman's story is one of resilience, grit, and commitment to reclaiming his life after stroke. His experiences will resonate with anyone who's been through the stroke recovery process or supported a loved one through it. You won't want to miss this powerful episode packed with insights into stroke rehabilitation, overcoming fear, and rebuilding after a stroke. Before we dive into Norman's story, I'd like to remind you of how you can support the podcast. If you find these episodes helpful, inspiring, or insightful, please consider supporting the show through Patreon at patreon.com/recoveryafterstroke. Your support helps keep the podcast going and allows me to continue sharing these powerful stories, offering hope and practical advice to stroke survivors and their families. Thank you for considering it. Norman Vandal, welcome to the podcast.
Thank you.
Thank you for being here. Tell me a little bit about what happened to you.
Well, I don't know if you're familiar with the Thanksgiving holiday in the States,
Mm-hmm.
kind of a celebration of the harvest and so on. And I was scheduled to go up to dinner with my daughter-in-law's mother and my family, and they live in Shelburne, which is about 60 miles away. And my contribution to the meal was to make some mashed potatoes. I grow a lot of potatoes in a potato piece field near here, and I always contribute potatoes. So I got up in the morning and peeled some potatoes and boiled them. And a while later, when they were done, I took them over to the counter and I was starting to mash them. And my right leg started to feel a little bit strange. Like if it was a four-cylinder engine, it was maybe running on 3.5 cylinders. I could still walk and move it okay, but it had a kind of odd numbness to it. I'm quite conditioned to feeling sciatic pain from arthritis in my spine, and I assumed it was some variation of sciatic pain. It persisted. It didn't get worse. I finished making the potatoes and got in a truck and left. And on my way to Shelburne, I stopped and put gas in a gas station, and I was, very comfortable doing that. But I could still feel the weirdness in my leg. And I started to drive, and I got, probably about two-thirds of the way there, and it started to happen in my right arm. So now my right arm and right leg are feeling weird, and I knew something was wrong, and I knew that since it was all on one side, that it was most likely a stroke. So I continued to drive, which I'm not sure was the smartest thing, but I had to get somewhere. And so I drove, and I got to my daughter-in-law's mother's place, and I walked in and said, "Carol, here are your potatoes. I'm having a stroke."
Mm.
And she said, "You are?" And I said, "Yeah." "How do you know?" Well, I explained, and she said, "Well, what do you want to do?" And I said, "I need to go to the hospital now." So she got an ambulance to come, and they, ferried me up to the University of Vermont Medical Center, and I was admitted immediately, and they started doing imaging. And during that time, it was getting progressively worse. Um, Not that I was entirely noticing it, but my children who were now there with me started to notice it. And it was, they brought me food to eat, and I was really unable to hold a utensil and eat. And my daughter said to me, she said, Dad, you're not eat, you can't eat. Your hand isn't working. And I was like, oh, no kidding, really. And I noticed that my leg wasn't functioning really
Um,
well either. Yeah. And she noticed it before I actually felt it. And then I realized what was happening to me. At that point, I started to get pretty concerned, because this was happening slowly. And that felt strange to me because I never heard of a stroke taking that long to happen. The full effects of the stroke, I mean, this started about 8 to 8:30 in the morning, and it really wasn't until 7:30 or so that night when it had sort of done the most damage it was going to do.
so how long
At
did
that,
you take to get to hospital though? How
oh, it
long?
was very quick because the
Uh,
hospital yeah, it's like 10 miles from the house, and the ambulance came right away. It probably took me, maybe 35 minutes.
when you went to hospital and
Oh,
said, "I think I'm having a
yeah.
stroke," did they
Yeah.
agree with you? Did they treat that seriously when you said that?
You know, they started imaging right away, so I'm assuming that they did. It's interesting, and I don't know if your other people who write in, other patients, feel this, but I was kind of out of it, really sort of confused as to what was going to happen next and where was this going, and so on. And plus, my children were there, and they're very capable, both very very intelligent adults, and they were pretty much dealing with the doctor, and I was basically in bed, almost being introspective and trying to figure out what the heck was going on. But they did the imaging right away, which leads me to believe that yes, they knew. And from my description of it being one on one side, they knew I was having a stroke.
So just one of the
So
things that I think
yeah,
is weird is that even
yeah,
though you were having a stroke and you suggested that you were having a stroke and they were doing the imaging,
yeah,
they gave you food. And stroke
yes,
survivors or stroke
yes,
patients, while they're in that state
yeah.
having a stroke, may have some challenges with their swallowing,
Or
and
they're
therefore
swallowing. Yeah.
food is probably not the right thing to do unless they've assessed you.
Hmm.
Perhaps
Hmm.
did they
Hmm.
assess you?
No, no, they didn't. They didn't assist me at all. And
Assess you?
and when they gave me
Did they
when they
assess
gave
you?
me part, they
Did,
assessed me.
yeah, did
Oh,
they
they did
assess you to
several
see your?
assessments. Yeah, yeah,
Yeah.
eyes and and so on, and movement, and could I cross my legs, and that sort of thing. And I have a feeling that they must have felt that it had done its damage and it was minimal. I guess. Um, I found, as I said when I wrote to you about my experiences, which was very brief, but that I had a lot of questions, and you're asking some of the questions that I had. And because I'm in a very rural place, the hospital communication isn't always the best, and I'll explain that a little bit better further on. But by the time the stroke had done its damage, I was unable to move my right leg, if at all. I could pick it up slightly. I was able to cross my legs, which they asked me to do. I could lift my right arm, but I had no dexterity or movement in my hand. I had no facial paralysis. I had no cognitive damage. I was able to speak. I had a little bit of numbness on the right side of my mouth that I could tell that it was affecting my pronunciation, but I don't think it was noticed by other people. And that's sort of a syndrome that I felt all the way through the stroke and still do, because people say to me, "Man, you're doing really well." And in my mind, I'm saying, "Yeah, but you don't know how I feel." And that's probably a standard thing.
Very
If
much
it
so.
looks good, we'll call it good, but in my mind, it's not where I want it to be. you know.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
So I stayed in the hospital there for 3 nights, and the plan was to send me to a rehab center called Fanny Allen, which is part of the UVM network. This is a teaching hospital. It's a hospital with a good reputation, but Fanny Allen has a superb reputation, but people call it the boot camp. And there is a reason. There was a young man in the bed next to me in my room who was very young, like in his early 40s, and he had had a stroke, and his condition was about the same as mine. He might have had a little more serious paralysis, and he was waiting to go to Fanny Allen the same way, and we were both concerned as to who was going to go first, because there's a lot of demand for people to go, and I was really fortunate to be able to get in there right away, because I feel that that's what really saved me in a lot of ways, you know. Yeah, so when I went to Fanny Allen, I was checked in, and I was assessed by a PT and an OT, and there was a different neurologist there working with me. And the following morning, I moved into in the evening, and the following morning, I started into pretty heavy duty PT right away. I couldn't walk. I could walk barely with a walker, but it was just no control really, and it was something they didn't want me to try or do. But immediately they got me into walking briskly on treadmills using a harness, suspended from a harness, and that way, if I fell, I was caught. And I honestly, I knew, sort of intrinsically or even philosophically, that this was the best thing for me, this boot camp. But it was frightening. I mean, it really, in some mornings, I had like a schedule and a protocol for the day. And some mornings I felt like hiding under the covers. I mean, it was just grueling, absolutely grueling, tiresome, more, both physically tired, but just almost emotionally tired, just really, really a feeling I've never had before. Um, I had really, really good people. Um, but to backtrack a little bit, when I left, I met with the neurologist at UVM a couple of times who was taking my case. And she told me that I had a stroke because of blockage in my basal artery on my left side, which affected my right, motion and so on of my right side. She gave me some targets that I had to try to achieve, sort of in my own personal life habits. And I had an A1C of about 6.1, which meant I was essentially type 2 diabetic.
Mm.
I had an LDL-C, cholesterol that was up around 120, and my blood pressure typically was maybe 160 over 80.
Mhm.
for blood pressure. And I'd been dealing with that my entire life, but not dealing it with it as seriously as I am now, I can tell you, and I should have dealt with it more seriously. But she
You weren't
gave me
taking
those
the
targets.
medication. You weren't taking.
Pardon? Yeah, I had been taking medication for blood pressure and for cholesterol, and I had been taking a statin, which I probably should have stayed on, but I dropped off of the statin because it was giving me muscle problems.
Mhm.
And that's happening to me right now on a statin that I'm taking. I know the seriousness of taking a statin, and I'm going to be back on it. I'm on a hiatus to try to get this back and leg pain to go away. Um, the neurologist at Fanny Allen explained something to me, and I don't know if this is something you've heard from other people or sort of dissected from conversations about statin, but he explained that what the statin does, aside from lowering your cholesterol, your bad cholesterol, and elevating the good cholesterol, he explained that what happens to plaque in your artery is that it it can have a rough surface. And if it does, it interrupts the flow, and it's sort of like a stream going over stones, wild river. And it makes eddies and disturbances in the flow, and that causes differences in velocity, which makes more plaque developed. And he explained to me that maybe the best part about taking a statin is that it's been shown to smooth out those blockages, which makes them more stable. And that was the assumption. Yeah.
The challenge with statins is actually very controversial these days,
Yeah.
and a lot of people are talking about how statins perhaps are not the right solution for high cholesterol. At the same time, what they're talking about is also they're saying that high cholesterol is not necessarily the problem causing plaque deposits in the arteries. And the fact that there are plaque deposits in the arteries can only really be shown with the correct scan of those arteries. So
Sure.
imagine that your neurologists have consulted some cardiologists and they've checked out your arteries to see whether or not, in fact, they are blocked up or whether they are free flowing, whether they have cholesterol deposits in there or not. So
They
the
do.
they do. So
Yeah.
there there tends to be a a approach by the medical professionals that all people who experience a stroke because of an ischemic reason, so for like a blood clot of some
Right.
description,
Sure.
uh, should go on a statin as a preventative, and for people who
Mhm.
have plaque deposits, they should go on there to reduce the significance of the plaque deposits. Now, that is potentially, and I'm not a doctor, so please,
Yeah. Yeah.
nobody
Yeah.
take my advice, but just think about
Sure.
my conversation just as that, a conversation. Don't do anything based on my
Got you. Sure.
discussion. Um, so the so they have this very big umbrella for why a statin should be given, and some people receive it when they shouldn't be taking the statin, especially when they haven't got cholesterol deposits, and and potentially their blood clot may have been caused by a um, a genetic condition that has a blood clotting disorder associated
Sure.
to it, rather than a blockage,
Mhm.
or um, rather than cholesterol deposits. So that's where the controversy kind of comes in.
Mhm.
Now,
Mhm.
one of the things that doctors don't say is that cholesterol can be resolved and sorted out, and so can the reduction of cholesterol deposits in the blood vessels by changing one's diet and by removing certain inflammatory foods that um, that are likely to support the creation of cholesterol deposits. And as a result of that, making those changes and supporting yourself to decrease the cholesterol deposits in your blood vessels naturally, then in combination with a statin, then at some stage you should be able to get to the point where you no longer require a statin. So the challenge is not so much for people who are 75 years old or over, it's for people who are put on statins at the age of 40, because statins are also suspected by some to be contributing to down the road neurological diseases such as dementia and Alzheimer's, because what apparently is the case, apparently, and I haven't researched this enough, but this is just some stuff that I've read from time to time, is that cholesterol, the good cholesterol, which is, in fact, there is no such thing as bad and good cholesterol, but that's just how they've labeled these two types of cholesterols. The good cholesterol is what the brain needs to keep itself healthy. It's a fat, and it uses that as a fuel source and energy, and depriving the body for 30, the brain for 30 years as a 40-year-old of good cholesterol ends up causing neurological problems down the road.
Sure. Yeah, like you said, maybe dementia or so on. Is there will there be, or is there clinical evidence of this now?
Certainly is. There certainly is clinical evidence.
Okay.
Now, one of the best places to start being curious about the way one should look at brain health, there's a book by a doctor called Dr. David Perlmutter, and I'll have the links in the show notes. Dr. David Perlmutter. It's called Brain. I'm just going to find it online. And he's a neurologist, board certified neurologist, and he has a clinic where he deals with people who have Alzheimer's and dementia. And many, many years ago, he wrote his first book, and it was about trying to show people how to go about decreasing the bad markers in their blood work and increasing the good markers in their blood work. And the book is called
predominantly dietary. Is that what?
All dietary.
All dietary.
So none of this is, my conversation with you about it is, none of this is designed to divert people away from the medical assistance that they are receiving, or their medication, or any of that stuff, because when there isn't another way out of this, when you don't have another solution, cholesterol medication or statins is definitely supporting the patient from having a condition right now that is going to be dangerous to their health. So it's really important that, blood pressure medication, unless your blood pressure stabilizes and becomes normal by itself, it's important to have it, because it's going to help you right now in the acute phase of high blood pressure, for that not to accelerate, become worse, and then cause a brain hemorrhage or a heart attack. So there is a need for the medications. Certainly, there is a need for medications, and they are proving to support people stay healthier, live longer, avoid stroke. Certainly. So the question is, what can you do to support that process as well?
Well, I had the goals of an A1C of 5.7, and right now I'm 5.1. So I'm no longer even close to being diabetic.
No.
I've lost 35 pounds.
Excellent.
Which is great. My LDL-C, bad cholesterol, is 39.
Excellent.
I've had to even ask the doctor if I'm alive. I've never heard of anyone with a 39 cholesterol, and my blood pressure averages about 135/65.
Yeah, that's so important. That's great.
Yeah. So I'm doing, this both frightened me, and is a monkey on my back as far as recurrence is concerned, and
Got you moving in the right direction.
sure. Well, my children say to me, "Well, don't you remember the doctor saying this? Or don't you remember this happening?" And I say, "No, I was lying in bed wondering if I was going to live the rest of my life like this.
Mm.
This was traumatic and very frightening,
What I'd love to
So
know, Norman, is
yeah.
how did you lose 35 pounds, or what changes did you
Well,
make
I'll tell
in your
you,
life?
while I changed my diet pretty radically, I thought I always ate pretty well, but I ate too much. And I did eat too much of foods that I wouldn't exactly call healthy. I wasn't a fried food eater, like to go to a chicken, fried chicken, or get fried fish and chips or things like that. But I did eat a fair amount of meat, and now I eat meat, but most of the meat that I eat, almost all of it, is venison, which
Mhm.
is
Very
which is
healthy.
very low, and yeah, very healthy, But the thing is, in my stay, I'm trying to stay chronological here, um, and not forget anything that I wanted to say to you. But the diagnosis that I got was, of course, like I said, an ischemic stroke from blockage that began in the basal artery. And so at Fanny Allen, it definitely was a boot camp. I mean, one of the things that they made me do that was absolutely frightening was they would tie a belt around my waist and a rope dragging behind me, and put a 30-pound weight in a bag, and they would make me walk. This is when I started to have some control walking. And they had me walk around the circuit in the hospital. And between these two lines on the floor, I had to walk as fast as I could. And it was just totally frightening. I mean, it's a hard floor, tile floor. And I thought, man, I'm gonna fall for sure. And of course, the PT was next to me to catch me, but I was doubtful that she could do it if I really fell. So that's just one of the things, and I am so fortunate, and I'm a strong, firm believer in doing this extreme activity right away, this physical activity, and this I think is so important. I know it was for me,
Do you still
you know.
do physical activity?
I do. I still do walking on a treadmill. But I actually live in a very rural place, and I do a lot of things outside, and I am constantly moving,
Mm.
constantly. I'm not a couch potato, or I don't watch much television. I don't spend an inordinate amount of time on a computer. I'm always moving.
That's really
So
important.
I'm keeping that up. Yep, I'm doing that. Now there was a neurologist at the at Fanny Allen who came in to see me one evening, and he said, I want to talk to you about something. And I said, sure. And he said, I'm going to draw a chart on a board, a graph. And he said, it'll have a vertical axis and a horizontal axis. And they said the vertical axis is percentage of use from where you are to 100% use. And the horizontal axis is time. And he drew a curve on it, and he said, this is a curve that most people see. And it was fairly steep in the beginning, then it leveled off, and it didn't go up to 100% of use. And then he said, from watching you, studying your stroke, seeing the way that you apply yourself, he drew a curve that was much steeper, meaning that I would get to use quicker. And that sort of heartened me, but I also sort of doubted it because it was so much work just getting where I was. And he explained that in the first 6 months, that was my prime window, but that recovery would be a year, to where I would see recovery, but it would slow down. And I was pretty heartened by that, and I thought about that curve a lot because I'm really big into visualizations. You know, if I can see things and turn them into narratives or pictures, you know, I'm able to understand them better. You know, and so that was important to me.
Let's take a quick pause here, but we'll be right back with Norman's incredible recovery journey shortly. Before we continue, I want to remind you about my book, The Unexpected Way That a Stroke Became the Best Thing That Happened. This book is not just my memoir, it's a practical guide for achieving post-traumatic growth after stroke. You'll read stories of stroke survivors who, like Norman, turned their trauma into an opportunity for growth. You can find it on Amazon or by visiting recoveryafterstroke.com/book.
One night, I was lying in the bed, and man came in, a doctor, and he said, "I'm Doctor So and So, and I'm a psychologist." And I said, "Well, I really, no offense, but," I said, "I really don't think I need a shrink right now." And he said, "Oh, no, no, no. I'm not here to shrink you." He said, I won't do that." He said, "I just want to tell you a couple things about stroke that I think will really help you." And I said, "Okay, that makes sense, you know." So he said, "The first thing is you're going to feel tired." And he said, "Very tired." He said, "More tired than you've ever felt in your life." He said that, and it's going to be a lot, you know. He said, "You're going to feel that tiredness a lot." And then the second thing was something I was noticing, but I couldn't quite understand. He said, "You're gonna cry a lot." And I was surprised, and I thought, you know, he's right, because I am. And I found that for a long time that was happening to me. I was sort of feeling almost mood swings, you know, where I would just be, everything would be fine. I'd be happy going along, and some inconsequential thing would happen, and I would be in tears,
Did
you
he
know,
tell
or
you what
things
that was
that,
called?
no, is it name for it? Is it
Yeah, pseudobulbar affect.
pseudobulba ethic?
Pseudobulbar affect. Affect.
Affect. Okay,
Yeah.
sure. Yeah, yeah,
Pseudobulbar affect. And it's a
yeah,
very common condition. And sometimes
yeah,
instead of crying, it's the
yeah.
uncontrollable laughing in inappropriate moments. And
Oh,
some people
really?
have reported being at funerals and laughing in
Oh,
when they're not meant to be, and then they're having
yeah,
to excuse themselves and
yeah,
not
yeah.
be in the room or wherever they are.
Is there a length of time that seems to persist, or
Well, for me, it was
you
pretty
had it?
extreme early on for the first,
Yeah.
say, 2 to 3 years, and then it started to settle down. But every once in a while, uh, a little while ago, I did my book launch, and I was in front of a room presenting
Mhm.
and talking about my experience with stroke, and it was a 45-minute entire presentation, the whole thing, 45 minutes from beginning
Mhm.
to end. And I think I cried 4 times, and it was
Really? Really?
unexpected, and I couldn't stop it from happening. I didn't think it was going to happen, but there are some little triggers, and one of those triggers is the people in the room. A lot of them are family and friends and my close
Sure. Yeah.
part of my
Yeah.
close community, and as a result of
Yeah.
that, it was really difficult to be up there and try to get this
Mhm. Mhm.
this presentation out. And I cried way more than I would have liked to, but somehow I got through it. And most days, it's not there anymore. That whole
Mhm. Mhm.
unnecessary crying has gone and settled down. Although
Yeah.
I do cry more often watching movies than I ever have in my life.
Sure.
Those types of things, and of course, the children when my kids who are adults, um, when we talk about something that's really close or dear to us or something moving, uh, I previously I would have been able to very much hide my emotions, whereas now
Yeah.
I
Yeah.
can't,
Yeah. So
and I
did you get
don't.
to where you were comfortable with that affect?
Yeah, I'm comfortable with it now, and now I'm
Mhm.
comfortable with the fact that I cry actually, and I
Yeah.
don't
Me
pretend
too.
it's not happening. And then the kids all know what it's about, and I'm just like, yeah, just crying again, guys. It's all good, and it doesn't mean anything. Um, but it's also
Yeah.
good to have a cry and get it off my chest, whatever it is.
Yeah.
It feels like there's kind of like a unspent amount of emotion that needs to be expressed and spent.
Yeah.
So then it
Yeah.
kind of gets it off.
Purgation, a release, right? Well,
Yeah.
I tend to, one of the things that sets me off now is that I'll be doing something and then I'll think, about where I was.
Mm,
And that brings me to tears, because I just I go right back there, and I see, like, one of the things that I need to do, and part of I believe is because of this affect and the way that it sort of makes me feel psychologically, is I'm very big on, like I said, on imaging and on being able to think that way, and one of the things that I need to do is I need to go back to Fanny Allen, the rehab center. I need to walk in there and I need to see that place again. And I need to feel whole. Do you know what I'm saying? I just
I do.
need to have that feeling. And I'm trying to build up the courage to do it because it's going to take some courage for me.
Mm,
And I know when I do, it'll bring the tears, but
mm,
that's okay with me and they'll understand. But I have to go back there. I have to close that circle because it's it's almost the only thing that will tell me where I was and where I am now, and to make that sort of memory connection. Now, you asked about weight. Well, one of the drugs that I was put on aside from statins and was Plavix, which is a blood thinner. And I was taking a fairly hefty dose of Plavix. I can't remember exactly what the milligrams were. But within a short time, I started to have taste issues in my mouth. And it got worse. And it got to where I couldn't eat because everything tasted so terrible that food was completely unpalatable to me. And it was worrisome. And would force myself to eat, and my son would tell me just how many calories I had to consume based on my height, and I kept trying to, and I started reading labels and trying to do, and I could not do it. And so I tried contacting the neurologist that I had up at UVM, and I went for 2.5 weeks, and she never got back to me. So I decided on my own that I had taken all of the medications before, with the exception of Plavix. And I made the decision on my own that Plavix was doing this.
oh,
So I quit the Plavix. I was taking 81 milligrams of aspirin too as a blood thinner. But a short while after dropping Plavix, I was sitting on the sofa one day and I started feeling very lightheaded and very weak, woozy kind of, and thought something's wrong. So right away, I called my son, and he was skiing over on the top of a mountain with his two girls, and he said, "Dad, I can't get there for like an hour and a half. So why don't you call your neighbor Bob?" And Bob said, "I did." And Bob said, "Yeah, I'll take you right down." So I went to the ER room in a little hospital south of here in the town of Randolph. It's a very rural, hospital, but it's excellent. And they checked me in right away from the ER, put me in and ran tests and so on. And I got a hospitalist doctor there who was just amazing. He was a kindred spirit, and his attitude and his approach, and it was just reassuring. And he said, your magnesium, did blood tests, and my magnesium count had tanked. And he said, explained to me just how important magnesium was for all these functions. And I was deficient in other areas too. And his explanation to me was, well, first of all, we're going to put you on magnesium. And I had 3 IV units, big, units of magnesium.
wow.
And yeah, I was so low. And then he said, at the same time, your symptoms are really like anorexia because you're not eating and you're no longer hungry. You no
Mm,
longer want to eat. And I said that's true. And all the while, the taste was getting better because I had stopped the Plavix. And I was in there for 3 days, and after 3 days, food was tasting better, and I was getting, I was getting more. I was feeling a lot better physically. I wasn't getting that wooziness or anything, but I think that may have been primarily the magnesium. Another thing I
And what
wanted
happened
to,
with the blood thinner though? Did they put you on a different blood thinner?
no, I was supposed to take the Plavix. Part of the protocol was for 60 days, and I quit taking it like at probably 50 days, or
Ah,
and I stopped and I didn't go back. And by that point, I was seeing my cardiologist, and I had pretty much dismissed going back to that neurologist. But I did have a Zoom interview with her, a Zoom appointment, which is the other time that I've done this other than now. And it was a scheduled appointment, and we talked, and I told her how I was doing, and she said great. And then I said, I have to tell you, you put me in the hospital. And she said, what do you mean? And I said, well, you never got back to me for 2.5 weeks. Well, did you speak to my nurses? I said, several times. I said, in fact, one got tired of me calling and was very rude to me. Which one was it? I said, well, why don't you and go look at the portal, which is what I've been doing, and you'll see. I said, I'm not gonna, sort of rat on somebody this way, I mean, really. So she apologized and so on, which was, okay, but still, this had done me some damage. So this was on a Thursday afternoon. On a Friday night at 7:30, she called me and she said, "This is Dr. So and so. I won't use names, but." And I said, "Oh, hello." And she said, "Well, I need to inform you of something." And I said, "What's that?" She said, "Well, you have a brain aneurysm." And I said, "What? Really?" And she said, "Yes, you have a brain aneurysm, and I need to tell you about it because it needs to be watched." She said, "It's very small, it's 1 millimeter, but you should keep an eye on." And I said, "Well, okay, thank you. I'm going to see a neurologist down at Dartmouth." I don't know if you've ever heard of Dartmouth in New Hampshire, Dartmouth College. And
I have heard of Dartmouth. Yeah.
yeah, it's an excellent place, probably the best around unless you want to go to Boston. So anyhow, that was the story there. But I also, one of the things that I wanted to relate to you that was really devastating for me is I live in a very rural location. I lost my wife 11 years ago, and I live alone, and I'm outside all the time. I garden, I hunt, I fish, I'm just really active, but I'm active here in what you probably would think is the wilderness. So having the ability to drive is very important to me. I had to ask friends and relatives, son and daughter, and to drive me everywhere. And so everything became this conundrum of, yes, people are willing to help me, and that's wonderful. But at the same time, it was hard to be in that position where I had to ask people for help continuously. And it was really just eroding. I mean, it was the worst feeling. And so part of what I was doing in my physical therapy was trying to enable myself to have enough movement and control. Cognitively, I was okay, but to be able to drive a vehicle, and so I was going to an outpatient PT nearby, and the therapist said, well, I was doing these things where I couldn't, if I put my heel on the floor, my foot flat on the floor, I couldn't pick up the front of my foot, couldn't pick it up at all. It was like paralyzed. And I gradually worked and worked and worked. And she told me something interesting. She said, I don't know if there's really clinical data to support this, but if you're going to do that with your foot, you should do it with your left foot and your right foot. Because she said, I believe that there's coordination between the two. She says, just like walking, you're not going to walk with one leg.
Mm-hmm.
And I started doing that. So I would tap with both feet. And I could watch myself. I was very, very driven to be back. Now, to get my license again, I had to take two tests. One was a cognitive test, and the other was a driving test. And it was very difficult to get these scheduled because there's only two people in the entire state of Vermont who do it. The first was up at Fanny Allen, and they were booked, and it would have been 3 months. And so I got one in Rutland, Vermont. But first I took the cognitive test. And when I did, the therapist who graded or scored me said, your testing is high as anyone with complete normal cognition. Your cognition is perfect.
Mhm.
And so then it meant the driving test. Well, I went to the driving test with my son, who drove me there. And I drove with this young man. He was a therapist, and he was also a driving instructor. And when I drove, he was more of an instructor than an observer. And he was very didactic, like, well, you made that turn too slowly.
Mhm.
You didn't get off the highway fast enough. You slowed down too much. And of course, I'm trying, I hadn't taken a driving test since I was 16 years old,
Mhm.
So, but I thought that I did pretty well. And I had, in my own mind, I felt like I had achieved what I needed to achieve, and I was there. Well, when we met afterwards and went to his office, he said to me, he said, "Well, I see nothing, no damage from the stroke that impairs your driving ability. However, you need more practice, and we need to meet again." And I did the other part of that syndrome that we talked about with laughing. I got angry. I got very angry, and I lost it. And I screamed at him and said, "You're victimizing me, man. You're hitting me with all of these little inconsequential things." And my son, who was in the room, was just horrified by my behavior.
So you
I
seem right now, you seem like that was ridiculous what you were
It
doing
was.
and how you were behaving. But right at the moment, you
Oh,
you thought it was justified.
well, my son said, "Why did you do that, Dad?" And I said, "Listen, sometimes a person has to do that." I said,
Yeah.
"Sometimes you have to stand up for yourself, and you have to do that." So I thought about it, and I gave it some thought. And my son was pretty angry with me for doing it, and thought, I wish I'd known more about the condition, because I might have been able to explain to him that some of this is the stroke, and
Mhm.
some of it I was genuinely disappointed and angry. So I wrote this young man a letter afterwards, and I apologized. I said, "I'm really sorry for having done this, but I'd like you to understand how much driving means to me in my life, and where I live and how I live." So he told me to practice driving with my son, which I did, and I did some with my daughter. And then I went back for the next appointment, which was about a month later. And we went out, and he was having the same thing, little tidbits of, "You didn't do this right. You didn't look in that mirror long enough." And none of them had anything to do with legality. They were all the idiosyncrasies that he would like to see in his students. And I'm thinking, what is going on here? So we get back, and he starts with this litany of what I did wrong, and I'm thinking he's not gonna pass me again, and I can't lose it again. So he then said, I'm gonna pass you. And I said, "Great, thank you." And he said, "But I need to say something else to you." And I said, "Well, okay, go ahead." He said, "You need to sell your house and move." And I had such a difficult time not to lose it. The only thing I said to him was, I said, "Listen, if you knew where I lived and what I do and how I lived, and you knew how much that meant to me, you would not say this." I said, I'm aware of where I am in life, but I do not appreciate you saying this to me." It was just disheartening. It was
That's interesting.
not
It's
pleasant.
interesting. It's a perception.
Yeah.
It's a conclusion that he jumps to based on other things that are probably not applicable to you. And then, most importantly, what he should have said was, "Why don't you get your license back, and at the same time, why don't we book in another 10 another 10 driving lessons, just so I can get you up to speed a little further, and then that
Yeah,
way you can
yeah,
both achieve the same outcome. You've got your license.
sure.
He's getting your skills back up to a standard that he thinks is more reasonable or
Yeah,
acceptable, and then that way you both win. And I think that's better. It's better to
yeah,
teach a person to fish than to take them
exactly.
fish every
Well, he
day, right?
told me that he had looked up where I lived on Google Earth.
Yeah.
And he said, I can see, I looked up where you live, and my feeling was, who gave you the right to do that? But I didn't say anything because I'd learned my lesson with the previous outbursts.
Yeah.
But what I found is I was fully capable of driving,
Yeah.
no problems. The only issue that I had with driving is the tiredness. And I'm sure
Yeah.
a lot of other people were in my situation. So I had to be careful that I didn't bite off a trip that was too long, and at a time when I was too tired, and I
Yeah.
did that.
Yeah.
And now I would say in terms of the exhaustion and tiredness, I'm doing quite well. I used to have to just stop in the afternoon and nap, or
Hmm. Hmm.
I don't need to do that anymore. I'm feeling, sort of revitalized, and overall I feel really good. I still have sciatic back pain, which I had beforehand, and it might be exacerbated a little bit more by the stroke, and I think it's because of the muscles that are being, firing again,
Yeah.
because that's a term they used all the time. Well, your arm is not firing,
Right.
it's firing, and that was a visualization I could see too.
So tell me about your health and your life before stroke. So your stroke happened
Mhm.
when you were 75. Um,
Yeah,
what was your uh the years leading up to that stroke? Because at 75, I
yeah,
imagine most people have had a condition of some sort or another.
sure.
What was
Well,
your
I had always had issues with high blood pressure. It's a congenital, almost, I think, genetic thing. Always. I mean, even when I was young and alive and rugged and active and
uh-huh,
athletic and everything, I still had trouble with high blood pressure.
uh-huh,
Yeah, always that. I was very active for a long time, did a lot of skiing in the woods and hunting and gardening and, fly fishing and stuff. And I think that the trauma of losing my wife had an
uh-huh,
effect on me, negative effect. Um, I like food. I love to eat. I like to cook. Um, and I was overweight, and I knew I was overweight, and I would try a little bit to try to lose some weight, but I sort of didn't take it. What's the word? I didn't see it as a serious issue when
uh-huh,
really it was. I had a heart catheterization once, because of a snafu and a stress test, and the hospitalist doctor told me I was going to have a coronary and I had to have a quadruple bypass, and he was sending me to Dartmouth for catheterization. When I went to Dartmouth, the cardiologist said, well, if you had done the stress test here, you wouldn't be doing this. It's because they flagged you that we have to. And they did the catheterization, and I had some blockage, but nothing serious, and I didn't need any kind of a stent or anything like that. So I guess I took that as a good sign, that I was doing okay. I fully expected to maybe have a stent, but maybe not a quadruple bypass. So I sort of, some people, I wasn't I had a pretty good gut on me. I wasn't obese, but I was 30, 35 pounds overweight,
yeah.
I carried it pretty well. I was still active. I felt well enough, but
Other than your
yeah,
extracurricular activities, what
yeah.
did you do as an occupation?
Well, I did a number of different things, and early on, I built houses. And then I became a cabinet maker and then a writer. I wrote about period technologies and woodworking,
Mhm.
furniture. And then I decided that that part of my life was not as interesting as what I might go to when I started teaching high school English. I had a degree in English and literature and a minor in education. And my daughter went to a very liberal, very progressive school here. And I thought, well, that's a school I could teach in without getting fired. And so I applied for a job there and did some subbing and I got that. So then I taught for 20 years, you know.
Uh-huh.
But during that time, I still was pretty active, you know. But
So you're 75 at the time of your
yeah,
stroke. That was about a year
yeah,
ago almost.
yeah.
Um, and
Well,
you're,
not quite 6 months.
yeah, you're the similar age to my parents.
Yeah,
My mum would be 78, my dad is 82.
right.
You, you're of that generation. When my generation speaks about your generation, we talk about how tough your generation is and that they don't make generations like you guys
Yeah,
anymore. Also, the generation before you was seriously tough. Your parents would have been extremely tough because they would have lived through World War One and World War Two,
sure.
amongst other things.
Well,
And
not one, but two.
okay, yep, not
Right.
one. Okay, and then there would have been a discussion about then there would have been a discussion about the fact that your generation doesn't seek out psychological counseling and talk therapies and that kind of stuff. So it was
Yeah.
interesting when the psychologist came to you and the first thing that you thought was, I don't need to see a shrink right now, which is
Mhm,
exactly what
mhm,
I would have expected you to say. Um,
mhm, mhm.
but how did you go about dealing with the loss of your wife and then finding yourself kind of alone in the world? And when I say alone in the world, clearly you're not alone. You have amazing family
Yeah,
around you,
mhm.
but alone as in, the
Yeah,
significant other aspect of your life. How did
yeah.
you find yourself dealing with that?
Well, it was difficult. There's no question, and it was a hell of a loss. And she had esophageal cancer, and it was, series of surgeries and so on. And she died at home in hospice, and which was a good thing. But I was home alone with her through most of the bout. My children actually, one, my son was living in Seattle, working in the wind industry, and my daughter was in Boulder, and her husband was getting a master's in psychology, and they came home. But still, the entire process, the entire time, I was dealing with her suffering and alone, and um, it was consuming. It just completely consuming, and really, what's the word? Just profound. Very profound. And when she did die, I basically went to bed and slept for hours because I was so completely exhausted. And then after then, it's been hard, but it's. I wish I could remember the phrase that Joe Biden uses all the time when he talks about grief because he's quite an expert in it. He's had enough tragedy in his
Right,
life.
right.
But what he says is true, that what used to, put a tear in my eye now can put a smile on my face. But it was hard because I did a lot with my wife and it was a loss. I'm pretty used to living alone. I live very remotely. My nearest neighbor is over a mile away. I'm up 1,850 feet in the mountains. So my life is, even though it's sort of immersed in nature, it's still relatively intense.
Yeah,
And just being involved in that was kind of a support that I needed.
yeah. Your description was that you went to bed and you slept for a very long time,
Yeah,
and you were completely exhausted. Some people would say that depression has that symptom, that
yeah,
particular behavioral pattern. Did you
right.
feel like now, reflecting on that, that perhaps that you were a little depressed?
No, I don't believe I was. And I've dealt with, enough with students over the years to have a pretty decent handle on, you know, being able to observe or pick out depression. And no, I don't, I was more just completely exhausted, both
Mm.
physically and emotionally. I just didn't, I'd given so much, I just needed to get away from it,
Just
with rest.
the
Yeah.
tapping, the tapping.
Oh, I'm doing that again now.
Yeah,
Okay.
that's all right.
Um,
So
it's
yeah,
my
so
pet
what you're
peeve.
saying is your response was appropriate to the particular situation that you
I
had
think
found yourself
so.
in.
I think so. Yeah.
Yeah.
Yeah. And it was an interesting process, um, because, and it still is, because I could see how everyone deals with grief differently. I can see that my son and my daughter deal with the grief and the loss differently,
Mm.
I think that in a lot of ways it's had an effect on me. There's no question, a cumulative effect, I believe, I'm I'm relatively happy, I mean, I like my life, and I haven't really put any effort into finding a mate.
Mm.
I do have female friends who are good friends, but I haven't really felt the need for that. I'm quite adjusted to being alone, and to being quiet, and
Yeah. And you
sort of.
spend time in the community, though. It sounds like it's not, you're not doing it completely alone. You're not a hermit. There
No.
must be times where you uh, uh,
Yeah.
involve yourself with the community. Tell me a little bit about those other things that you do other than your home life.
Well, I don't do a whole lot, and I'll tell you, because this is a very rural place. I mean, this town only has about 500 people.
Uh-huh.
It's very, very small. I have friends that I see and do things with, go out to dinner, and,
Mm.
work on projects together, help each
Yeah.
other to do things, and so on. Yeah, I have involvement with other people, and I have plenty of friends that if I felt lonely, or I would say, I say sometimes I feel lonesome, but I don't feel lonely.
Uh-huh.
I'm not a lonely person, but I can feel lonesome. And when I do, I try to reach out to people, and the people who've helped me during the stroke, it just astonishes me. It's humbling. I mean, I can't, people offering me, and it's overwhelming,
It's
really.
one of the best things, isn't it? It's such a thing, a very common thing that gets reported by stroke survivors is the people that come out of nowhere and offer their
Right.
support in any way that they can. And it makes it such a big difference to
Sure.
somebody's recovery
Sure.
and how they go about navigating the months after stroke. It's really interesting.
Right. Prior to coming home, I spent, after Fanny Allen rehab, I spent 2.5 weeks living with my son. And he has three girls, three daughters, and Georgia is 9, and Willa's 7, and Elsie was not quite 2 at the time. And it's just another situation where, if I think back about the disabilities that I had at the time, it's just really overwhelming. But I could watch my granddaughter, Elsie, who was, not quite 2. I could watch her learn things, to do physical things with her body, and learn sort of intellectually. And it was so parallel to me.
Mm.
It was just such an incredible observation, a feeling
Wow.
that I had, I could see, and I would think of myself as being in that position again,
Childlike.
childlike. And yeah, childlike in both, but in the eagerness to learn, but also in the inability to do what I wanted to do. And I could see her frustration in her learning. And the other thing I could see is her learning by repetition, which is exactly what I had to do. I remember one day I watched her get up from the floor, and then a physical therapist came, and I said to her, I said, "Do you think I could get up from the floor?" She said, "Well, do it." So I laid down on the floor, got down as best I could, and I tried getting up, and I put a hand on the table and I was able to pull myself up. And it was just mind bending for me. It was like I could have, it was a gold medal, you know? I mean, I was just blown away by the fact that I could do this. And I got to where as much, I have to say that this stroke has taught me so much about myself, about other people. Now I do things like I do 99% of what I've ever done, but it isn't easy, you know. And there are times like I've been working on a tractor recently and I have to reach in and turn, put a nut on a bolt, you know, and my hand has not been taught to do that yet.
Yeah.
And so I reach in and I grab this nut. I'm fumbling and I'm trying to hold it and it drops. And I try to pick it up and I do. And I try again. And the weird thing is that I can feel the connection between my brain and my hand. I can just, do you know, did you get that feeling
I
too?
do know exactly what you mean. So
Unreal.
I have a very deep understanding of either the lack of connection or the connection, because
Yes.
depending on the day, sometimes the connection operates better and sometimes it operates less. Especially for me, it's in walking more than anything. So I
Yeah.
noticed that on uh, a day where things are not going as well, it's like the connection's not there, and the way to restore the connection in a way is to stamp my foot on the ground and just to let the
Yeah.
brain know this is what you
Yes.
are looking
Yes.
for.
Yeah. Yeah. Yeah.
Get onto
Did
it, you
you
know?
find did you find that anger helped? Like sometimes I say, "Damn it, I'm gonna do this. You gotta do it," you know, and I get
Yeah.
angry. Most of
That's
it's
more
probably trained
determination. That's more that,
determination, right?
yeah,
Yeah.
grit and
I found that
determination.
that worked.
Yeah. It's
I was
useful.
working with a PT one day, and she was making me take a ball in my right hand and throw it at this trampoline that had was on a slope, and so the ball would bounce back to me. And she'd say, "Well, throw it with your right and catch it with your left." And I just could barely do it. I mean, I was throwing just so ungainly, you know, awful, you know. And I said to her, I said, "Do you mind if I get angry?" And she said, "No, go ahead." And I went, "You son of a," you know, and I really, and I started cussing and getting, and I threw that ball perfectly. And you know what I did? I caught it with my right hand.
Uh-huh.
I was blown away, you know, and I thought, why this is contributing. Like you say, it's determination, but
Yeah.
it's also that when I would do that, I would feel that brain connection more. And I have to say, that's a wonderful thing.
Yeah.
It really is a wonderful thing, despite the stroke and all that, you know.
It's a correctly channeled aggression, perhaps, right? It's
Maybe,
correctly
yeah.
channeled. Yeah. And it's rather, see, I've seen people who have done what you're saying, but in a negative way, in that
Right?
they are being negative and aggressive to themselves and beating
Sure.
themselves up about the fact that their arm is not working, etc. So I've seen that part of it, but the part that you're talking about is more appropriately channeled, and then therefore you use it to help you and support you, and you get a result out of it, and that's good
I
that you can
do.
observe that. I was
I
going to
do.
ask a little earlier, what's the
Yeah.
hardest thing about stroke?
I think the hardest thing for me has been, um, and maybe it's because I do live alone, but it's been my loss of independence, you know, from the beginning. Now I'm almost completely you know, independent now. That was really difficult for me because I was always a really independent person, both you know, sort of in my habits and in the way that I live, but even in the way that I think, you know. And I've always been very focused on accomplishments, but not I'm not talking about being any sort of a hero or, but it matters to me that I'm able to do things and get them done. and there are things that I enjoy. I enjoy working. I always think about the Shakers who say, was it um, mind to hands and heart to God, like feeling that. And that was really hard for me to lose that independence and to get it back now. And the only thing now that I have, like I said before, is this monkey on my back and the possibility of a recurrence.
Yeah.
I'm doing everything that I possibly can to avoid that,
Yeah.
and still I know there's a chance, you
Yeah.
know. So now when I went to visit the neurologist, my new neurologist at Dartmouth, I met with him, and he asked me, how I was doing and what my tests were, and so what my numbers were, and it was the first time I'd met with him, and he said, "Well, tell me about your stroke." And I said, "Well, I had blockage in my basal artery, and it contributed, ischemic." He said, "No, no." He almost laughed. He said, "The basal artery doesn't feed that part of the brain." So now I'm thinking, what is going on here? He said, "It doesn't feed that part of the brain." And he said, "The basal artery was not involved in your stroke."
Right.
At the time, I understood that he told me I'd had a bleed, which was hemorrhagic, which was completely different, you know. And so I contacted him recently and I said, "Listen, I'm really unclear about this." It was so shocking to me that I wasn't asking the right questions. It would just hit me like, what went on? So he wrote back and said, well, first thing he told me, he said, "I can't tell you to do more than you're doing, because your progress and your numbers and your weight loss, everything is exactly what you should do. It's what I would tell you to do, and you're doing it already."
Yeah.
So, and then I said, "Well, what about this brain aneurysm?" And he laughed. He said, "A 1 millimeter brain aneurysm in a 75-year-old man?" He said, "That's so small, it's well within the realm of misdiagnosis." He said, "In your lifetime, that 1 millimeter brain aneurysm is not going to grow and rupture." He said, "If you were a 45-year-old man, I would treat it differently." But he said, "I can't even tell you that it exists." He said, "So do not worry about it. It's not there." He said, "Just don't, it's not gonna happen," which was good. So recently I was thinking about, well, okay, well, if this was ischemic, then I'm dealing with plaque. I'm dealing with that blockage. But if it's hemorrhagic, I'm dealing with a separate set of circumstances. But I thought, well, but the protocol I think is the same, right?
It's
Blood
not much
pressure,
different. Yeah. Blood pressure needs to come down and under control. Um,
sure.
Blood vessels need to be clear and operating and allowing blood to flow without any
Yeah. Yep.
without any plaques, so that you're all on all the right protocols. There's no other
Right.
thing that you might be doing. However, it might be good to see if you can get some clarity on what type of stroke it was. Perhaps your neurologist can read the
Yeah.
reports from back in the day and find out
Well, this
what
is,
exactly happened, because that first neurologist seems to have
yeah.
given you maybe only half the story or not the full story. There
Oh,
seems to
yeah.
be
Yeah.
certainly some communication breakdown
Right.
with with that first neurologist. Something's not right there.
Yeah. Yeah. It makes me feel like, do I need a third opinion?
I, I
But
I would say yes. Why not? I mean,
yeah.
I did
Yeah.
that. I did that a number of times. I went to see a lot of doctors. My scans
Sure.
were viewed by a neurologist in Greece who happens to be my cousin, who was never going to treat me. Then there was another doctor who I saw in one particular hospital for the first incident, and then I left that hospital and took myself to another hospital where I had another opinion. So
Sure.
absolutely. The more information you have, the better you are. And if you can reduce
Right.
the anxiety in your mind, in the back of your mind about what actually went wrong and how am I tackling this, then I think it's very valuable to get another opinion. And doctors all are used to patients getting second opinions.
Sure.
And
Yeah.
I
Yeah.
don't think anyone's going to be offended by that.
No, and I don't worry about doing that. I'm
Yeah.
not concerned about it. I'm a pretty good advocate for my own health.
Yeah.
He wrote me when I said, tell me, I'm really unclear. I remember you saying it was a bleed. So he wrote to me and he said, I never said it was a bleed. And I thought, well, gee, I think I heard that. But here again, maybe it's the stroke and I'm not, I don't know.
Uh,
But he said to
well, it
me,
could be you.
yeah, I
So,
had a left putamental and corona radiata infraction due to penetrating artery disease.
okay.
Okay. Chew on that one.
Penetrating
Artery
um
disease.
artery
Yep.
disease. So
Left putamental and corona radiata infarction due to, and then he said, you have asymptomatic stenosis of cervical right ICA and basilar artery,
right. Okay.
which
So
I think is telling me that I do have some blockage in the basal
yes,
artery.
yes. Okay. So it sounds like you're on the right track as far as your protocols, everything that you're doing, exactly what they're
Yeah,
saying. It sounds
sure.
like somebody is aware of exactly what's going on. And that thing that you said about yourself is perhaps the stroke is causing you to misunderstand or hear things or imagine things that weren't said.
Yeah.
That's a very interesting observation as well to keep in
Hmm.
mind and to be aware of. And it's great that that you tested him on the fact that you thought that he said you had a
Right.
hemorrhagic stroke and he corrected you and said, no, you didn't. And I never said that. That's good too.
Yeah.
I mean, they're the
Well, when I,
conversations you need to have. That's how things get cleared up.
yeah, yeah. And that third opinion you would advocate for.
Absolutely. Yeah.
Yeah.
Because then you
Yeah,
have
I
more
think
data.
I'm gonna pursue that. So now you were saying about how sometimes your progress seems to there are good days and bad days, I guess is a way of
Yeah.
saying it.
Yeah.
And I find that when I'm tired and I and I'm and this is one thing, if I could ask your audience a question, this would be one of them. When you're tired, when I'm tired, it seems to go south. It
Yes.
just seems to be it moves backwards,
Yes.
and I'll find that I have a little bit of wiggle in my foot. My leg doesn't feel quite as strong, my arm is a little bit more shaky. And is that something that you have felt? And how long does that last?
Yeah. So for me, if I have a bad night's sleep or if I had a couple of big days where I didn't rest enough or did too much,
Sure.
then what happens is the deficits increase and get worse, and I notice them more. And then it settles down when I go back into a proper sleeping routine, for example, and then
Right.
things settle down and I notice it less. So it may not be a deterioration or that you're going backwards. Well, in your case, you're not going backwards. What it is perhaps the inflammation that occurred that impacted your brain in a negative way is just kind of rearing its ugly head and letting you know that
Huh.
you're still not 100% and you need to pay attention to your symptoms, and then you need to rest more perhaps, or you need to alter your diet, or you need to do a little less physical activity.
Right. Sure.
You'll know what it is that kind of sets you off down that path of not feeling so great, and then you can just ease back on that.
Yeah,
It's
I'm
very
trying to read that. I'm very big on letting my body speak to me,
yeah, yeah,
and I'm trying to read that. There are days when I feel a little bit woozy,
yeah,
slightly dizzy. A weird thing that happens too is that I wear reading glasses. I'm wearing them now, and they're basically what I call drugstore glasses. They're magnifiers.
yeah,
And if I happen to be working with the glasses on, and then I stand up or whatever, and I walk a few paces, I get so dizzy so quickly.
yeah,
It has that effect, and that's a standard, reaction anyhow, but it's so much hyper,
yes.
so much greater now than it ever has been.
So I had a very long time where my brain was playing games, and tricks on me where I felt like I was in another plane, in another dimension. I was having these weird kind of out of body experiences
Yeah.
and I would take a little bit of time to kind of reset and go back to baseline, and it was happening just on a normal day. I wouldn't think that anything had changed or anything was different. And then all of a sudden, I'd be feeling spaced out or
Yeah.
lightheaded, and I'd need to rest and sit down. It's not uncommon that there's still stuff settling down in there and there's stuff
Yeah.
moving and changing. So it's not uncommon. The important thing is to for you to be certain that your lightheadedness or the conditions that you um, notice are not, say, a sudden drop in blood pressure to too
Right.
low or a high or a response to something else. That's kind of the only thing you need to be aware of. And I would make this type of information known to your medical professionals that look after you and let them know
Well,
that
the
these things
neurologist,
happen.
I told him about this feeling of dizziness and lightheadedness sometimes, and he said his explanation was, he said, well, you've dropped 30 to 35 pounds, you've lowered your blood pressure substantially, your A1C is lower, you're getting used to functioning with less highs and lows of glucose,
Mm,
and he said, and you've had a stroke.
yeah.
And I also have stenosis in my aortic valve, which has not changed in years. It's not symptomatic at all, and it's very moderate. And he said, but it could be that stenosis under the circumstances is causing you to feel lightheaded. So I am trying to observe, like I said, let my body talk to me
Mm, mm,
to so that I can sort of feel it out. If I can figure out the scenario or the triggers or
mm, mm.
what it is that causes it. And just having to do those things is both it's a blessing in a way, honestly. I really feel like it's teaching me about my body and my brain and the way it functions.
Yeah,
I
you touched on all the
Yep.
things that you learnt from stroke earlier that you're
Yeah.
learning so much. What's something that you've learnt about stroke that's really had a profound impact? What's something okay, let me rephrase it. What's something that stroke has taught you?
Something that what?
Stroke has
Stroke.
taught you
Um, well, in sort of in a you know um,
philosophical kind of way.
philosophical sense, it's taught me a lot about fragility. I mean, I'm 75 years old, and I do not feel like an old man.
Mm,
I don't. And I always, my entire life, I've said I'm never going to walk like an old man. I'm not going to let myself walk like an old man. And I see friends of mine who are my age and they're walking like old men. Well, I don't. Even with the stroke suffering, I don't. And I'm proud of that. But at the same time, what it's done is it's taught me about this fragility and of life. And I'm sure I would have learned some of that also from just my age. But I'm aware, and the monkey's on my back, and I know something's going to get me. I'd rather it not be a stroke and have to put my family under a lot of stress and
mm,
be incapacitated that way. So I guess most of what it's taught me is, but I don't want to make it sound like it's entirely negative. These are negative things that I've learned, but the positive things that I've learned too, I've learned about what inner strength I have to be able to do this. I've learned about fear. I've learned about sorrow. I've been able to experience my body in ways I've never been able to do before, and I think it's wonderful.
mm,
I think a lot about the brain, and I never have before. How the brain is wonderful and how it functions, and what it needs, and so on. So it's been a learning experience for me in many regards. And I just hope that that's true for a lot of people, that that's a common feeling because and like I said, I've recovered to the point of where most people watch me and they say, I can't tell you how to stroke,
Yeah.
and I say to myself, yeah, you can't, but I can,
Yeah.
you
That's a
know, I can,
compliment to you, but they'll never
yeah,
know
it's
what it's
not,
like to be you because they've never had a
exactly.
stroke. So we don't want them to know anyway.
I'm
It,
not insulted by it or
no,
anything,
no.
Yeah.
Yeah. It's
So
better
you
that
know
they
what I
don't know.
mean.
Um,
Sure.
as we wrap up, I'd like to
Yeah.
ask you to see if you can impart some wisdom on our listeners. There's people that are listening that are
Yeah.
your age, my age, younger, going through something similar. What would you like to say to them?
Mhm. Yeah, I've thought about this a bit. I think the main thing is something I've already touched on is that, well, to preface it, I don't really consider that the stroke that I had is as devastating as what a lot of people have. And I'm
True,
fortunate for that,
true.
for sure. And I know that. The specter of having that as a possibility is there, but it wasn't. But I would say to people that I think that people need to get people need to find a place where they can basically see the 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 goodness in this too. You know what I'm saying? That it has so many sort of side benefits that you're not aware of before, like how important friends are and
Mm.
family and the support that you get, and how important it is to learn to focus more on your body and to learn more about your body and to know how to manage hope and fear, and because I sat in a bed thinking and like I say, I wasn't as bad as a lot of people condition, but I thought many times I don't want to live like this. This isn't how I want to end my life. We have a death with dignity law here in Vermont, and I thought many times about how, in order to put that in place, you have to have cognition. You have to know what you're doing. And I would think, gee, I hope I don't lose that, because if I have to make that decision, I want to know what I'm doing. I'm not there, for sure, and I wasn't there, and I didn't go there. But it is an option for us here. But I think a lot of people find themselves in a situation where they can't make that choice.
Yeah,
But I can smile about this. I've been able, and smiling feels pretty good, and I can smile about it now. I hope that it doesn't happen to me again. I'm going to do everything in my power to make sure that it doesn't, you know. But yeah, yeah.
it's
So
silver
I agree.
linings. There's some silver linings there.
Silver
That's
lining, exactly.
yeah,
Yeah.
it's a good thing to be aware of and to seek them out, so to speak, and to
Sure.
understand them. Hey, Norman, I really appreciate you reaching out and being on the
Yeah.
podcast. It's really great to have you on. We had a great conversation, and I am sure, as you requested in your email that you sent me, I am sure that it is going to make a difference in other people's lives, and it will be very
Mhm.
interesting to hear
Well,
your
I
approach
would
to
listen to your
recovery.
podcast. For me, what it was, it just became this ability to have, in a way, have my own conversations while your podcast was going on, and to hear from other people and their experiences
Mm.
and find that commonality, just to be able to feel like I'm not alone. I need this, and I suspect that's one of the main reasons why you've done what you've done. But
Certainly,
I really and truly appreciate it. I do.
it's my
I've
pleasure.
listened to. Yeah, yeah. It's a great thing that you've done, and hope you keep doing it, because people aren't going to stop having strokes,
This,
unfortunately. Yeah,
unfortunately, not. I certainly am. Thank you so much for being on the
yeah.
podcast.
Well, if you ever find yourself in Vermont, in the States, you come and you're welcome to stay here, and I'll show you some beautiful country.
I'll look forward to it one day. You never know what happens.
You never know.
Yeah,
Exactly. We
you,
never know.
you never know. Thank you
Yeah.
for the invitation. Um,
Okay.
all the best. Thank you so much.
Yep. Thank you. Yep.
Well, that brings us to the end of another episode. I hope that Norman Vandal's journey of surviving a basilar artery stroke inspired you as much as it has inspired me. His determination to overcome the physical and emotional challenges of stroke recovery and his insights into rehabilitation and life after stroke are truly remarkable. Thank you to everyone who has already left a review. It helps others find the show and provides much needed encouragement to stroke survivors. If you haven't already, please consider leaving a 5-star review and sharing your thoughts on iTunes and Spotify. And for those watching on YouTube, remember to like, comment, and subscribe to stay updated on future episodes. If you'd like to further support the podcast, you can do so by subscribing to our Patreon page at patreon.com/recoveryafterstroke. Every contribution helps bring more stories like Norman's to people who need hope and advice on their stroke recovery journey. Finally, if you're a stroke survivor with a story to share, I'd love to hear from you. My interviews are relaxed and unscripted. Just come as you are. And if you have a product or a service related to stroke recovery, consider sponsoring an episode of the show. Visit recoveryafterstroke.com/contact to get in touch. Thanks again for joining me today. I look forward to seeing you in the next episode.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.